All right, so Peter, today we're going to be doing an assessment of your head, ears, eyes, nose, and throat, as well as your heart and your lungs, both front and back. How are you feeling today?
I'm doing fine.
Okay, good. All right, so first I'm looking at the overall patient. I'm looking at his face for symmetry. I'm noting any tics with his face. I'm kind of looking at his eyes, just an overall view. Does he have any crusting of the eyes? Anything that stands out to me as not looking normal. So I'm going to assess the head and the hair. I'm looking at his hair, the texture, the distribution, any areas of thinness. I'm looking for any lice, anything in his hair to see how the hair's clean. I'm also inspecting just to see how his skull bones are, see if there's any swelling, any areas, indentations or anything like that. And he's not. He has a very good, nice, symmetrical scalp, symmetrical face. Then I'm going to check cranial nerve 7. So Peter, I'm going to have you smile, and then I'm going to have you frown, and then I'm going to have you puff out your cheeks. Okay, very good. So I also want to check cranial nerve 5. So Peter, I'm going to just check to see if you have sensation. I'm going to kind of run my pin along your forehead. Do you feel that?
Yes.
Do you feel that on your cheeks?
Yes.
Do you feel it on your chin?
Yes.
All right. So I am going to go down and I'm going to auscultate and I'm going to feel his temporal pulse here. And I do feel it. Okay. I'm going to check to see if he has any bruits. And just listen to his temporal pulse. Next, I'm going to check cranial nerve 2, which is his visual acuity. So, Peter, I'm going to have you cover one eye. With your left eye only, tell me which is the smallest number you can read up on this chart up here.
L, P, L, T, F, P, H.
Okay, that was 2020. So go ahead and cover your other eye. And I'm going to have you read this other smallest line you can read.
L, T, F, P, H.
Okay, that was 2020 in both eyes. Very good. So now, Peter, I'm just going to look at your eyelids. So I'm looking at the eyelids. I'm looking for any swelling, crusting, drainage, anything with the eyes that just is not normal. I want to make sure everything looks healthy as far as the eyelids go. There's no swelling, drooping, or anything like that. I'm going to have you look up, Peter. I'm going to look at the lacrimal duct. I'm looking at the sclera to make sure it's white. I'm looking at the conjunctiva to make sure it's nice and pink, and it is. So there's nothing unusual about that. Okay, Peter, I'm going to check your response to my light here. Checking the pupils, and what I'm looking for is to make sure the pupils are equal, reactive to light, accommodating. So I'm going to come in from the side, and his pupil reacts to my light. And I'm going from this side, and this one is reactive to light. And then when I come in again, I'm looking to see if the right side is accommodating to light. So we have accommodation. So both pupils are reactive to light. They're nice and equal and accommodating. Okay. So we are going to check for visual fields now. I'm going to do the 6 cardinal visual fields. So this is just checking for cranial, how the muscles of the eye move. I'm looking particularly at cranial nerve 3, 4, and 6. So I'm going to do the 6 cardinal movements. So Peter, stare straight ahead at first. And I'm just going to have you look at my, okay. And I'm going to go over here, across and up. Okay, very good. Okay, Peter, I'm going to have you, I'm going to check for cranial nerve 7. I'm going to have you raise your eyebrows for me. And I'm going to have you shut your eyes real tight. Very good. All right, so we've inspected that. And now I'm going to look with my ophthalmoscope and I'm going to check for the red reflex and the internal structures of the eye. Okay, just looking at your eye here. I want to make sure I'm holding his head still. Like that. Okay. Very good. And then look at this side. Very good. Okay. All right. So now I am going to be checking. I'm just making sure I'm not missing anything. I'm going to be inspecting and looking at your ears, Peter, and I'm looking at the external structures of the ear. I want to look at the pinna, and I'm making sure that there is no swelling, no nodules. I'm looking for skin tags. Hold the camera still. So I'm checking to make sure that there's no skin tags, no crusting, no tenderness. Is there any pain when I do this?
No.
Okay. And now I'm just going to take my otoscope and I'm going to look at the internal structures of the ear as well as the internal ear canal. And I'm looking for any cerumen, excessive cerumen. I'm also looking at the tympanic membrane to make sure there's no swelling, redness, it's not perforated. So I'm going to make sure I don't touch the external part of the ear canal here to cause any pain. Is there any pain? And I do see the tympanic membrane, and it is pearly gray and opaque. It's not, no redness, no drainage, no swelling. So I'm going to check both sides. Okay. Okay. It looks good. Okay, so now I am going to check the nose. And when I look at the nose, I'm looking to make sure the septum is nice and straight here. While I'm here, I'm going to check the sinuses. So any pain with your sinuses here?
No.
Okay, that's your frontal sinus and your maxillary sinus. Any pain or tenderness?
No.
Okay. Now outside of the nose, I'm looking for drainage, bleeding, anything unusual. And I'm just going to look in the nose here. And I'm looking at the turbinates, the upper and middle. And I'm looking for any lesions, any drainage, anything unusual, any polyps. And I'm also looking at the septum to make sure it's straight. And it is. And I also want to make sure I don't touch the septum because that can be very tender. So we're looking at that. Okay, so I would like to palpate the mastoid around the ears back here. And when we're checking the ears, I already checked the internal and external ears. I'm just feeling the mastoid. I also want to check some hearing, do some basic hearing tests. So the first one, Peter, I'm going to have you put your hand over your left ear so that you can't hear only out of your right ear. And I'm going to whisper a word, and I'm going to have you repeat it to me, okay? I'm going to whisper a little word.
Cat.
Okay, cover this ear.
Dog.
Okay, do it one more time. You could also do this test where you rub your fingers. Do you hear me rubbing my fingers?
Yeah.
Okay, do the other ear. Okay. Did you hear that?
Yeah.
Okay, very good. And now we're going to use our tuning fork. I want you to tell me when I place this on top of your head, which ear you feel the vibration or hear a vibration more. If it's equal, just say it's equal, okay?
Both.
Okay, very good. That is the Weber, and this is Rhine. So now I'm going to place it on your mastoid bone. Tell me when the vibration stops.
Right there.
Okay. Now tell me when you can no longer hear it. And I'll would be timing this? This is air conduction.
There.
Whoops. Mastoid.
There. There.
Okay, very good. Now I'm going to be checking the mouth. I'm going to look inside your mouth. Peter, if you could say, oops, let me get my, I'll use the pen light, it'll be a little easier. All right, I'm going to check the uvula. Say ah. Okay. Checking the oropharynx, making sure the uvula rises. I'm also looking at the oropharynx to make sure everything is pink. I'm checking for the teeth. I'm looking for cavities. I'm looking for any missing teeth or dental problems. I'm looking under the tongue. I'm looking for any signs of oral cancer, any thing that just doesn't look right as far as the mucosa, making sure it's nice and pink and even. Checking the cranial nerves. So I'm checking for cranial nerve 9, which is the elevation of the uvula. And I'm also checking cranial nerve 12, which is the movement of the tongue and the strength of the tongue. Okay. All right, Peter, I would like to check your masseter muscle. So I'm just going to feel here. I'm going to have you open your jaw for me. That's the TMJ. Close your mouth. And then I would like you to open your mouth against resistance. This is cranial nerve 5. Okay, very good. All right, now I'm going to check your lymph nodes. Okay, so we're just going in here. We're checking the preauricular. So I'm just gently going up and down here to see if I feel any preauricular lymph node swelling, and I don't feel any. And then I'm going postauricular, which is back here. I'm just feeling for any swelling of the lymph nodes here. And then I'm going back here to the occipital to see along the base of the skull if I feel any lymph nodes there, and I don't feel them. Okay. Then I'm going here. This is the submandibular, right under the jawline. Just feeling for any swollen lymph nodes there. And I'm going the postmental, so underneath the mentum here of the chin to see if I feel any lymph nodes there. I don't feel any. Finding the sternocleidomastoid muscle, I'm going to go just in front of it and feel for the lymph nodes here in front of the sternocleidomastoid muscle, which are the superficial, cervical. Mine went blank. I'm going to go all the way down. I don't feel anything. And I'm going to go to the posterior, back here, behind the sternocleidomastoid. And I don't feel anything there. Then I'm going to do the supraclavicular, which is right above the clavicle. And I don't feel anything there. And then underneath the clavicles, I don't feel anything there. I forgot the tonsillar. The tonsillar would be right up in here. I don't feel anything there. Okay. Next, I'm going to check the position of the trachea, and I'm going to do this with my thumbs. So I'm just going to go down and make sure the trachea is nice and midline, and it is. I'm going to go behind the patient, and I'm going to inspect for the thyroid gland. I'm just feeling. Peter, I'm going to check your thyroid gland. I'm going to pull it a little bit to the left. I'm going to feel. So the thyroid gland should not have any nodules. It should have a nice smooth rounded edge. Peter, I'm going to have you swallow. Okay. And then I'm going to do the other side, pulling this a little bit to the right, this trachea to the right, And I'm feeling, and again, the left edge should not have any nodules. It should be nice and round and smooth. Swallow for me. Okay, very good. Okay. Next, I'm gonna look at the neck. I'm looking at the arteries. I don't see any visible pulsation. His neck veins are not protruding, so they're not visible. I'm gonna feel for his carotid pulse. And I do feel his carotid pulse. And now I'm gonna listen to his carotid pulse for any bruise. And I don't hear anything there, no bruise, no visible pulsations or anything like that. I'm going to check cranial nerve 11. Peter, I'm going to have you shrug your shoulders for me. Very good. Up, down. And I'm going to put my hand here. I'm going to have you turn your head to your left against resistance, checking cranial, and then the other side, cranial nerve 11. Very good. Okay. I'm going to have you do some range of motion for me just to see how you are with that. I'm going to have you kind of rotate your neck for me. Any pain with that?
No.
Okay, then I'm going to have you turn your torso and just do some range of motion there. Feeling okay with that?
Yes.
Okay. Next, I'm going to have you turn your back to the camera. And I'm going to check your posterior chest. Okay, so first off, I'm just going to have you take some nice deep breaths for me. I'm looking for symmetry. I'm looking for any accessory muscle breathing, anything that looks unusual. So he's got a nice even symmetry and no accessory muscle usage. So now I'm going to just palpate the thorax and assess for symmetry. So I'm going to put my hands like this. Take a nice deep breath for me. Okay, again. Okay, that is nice and symmetrical. Now I'm going to check for tactile fremitus. So Peter, I'm going to put my hands here and I want you to say 99.
99.
Anytime my hands touch you, say 99.
99. 99. 99.
Very good. Okay. While I'm back here, I'm going to listen. First, I'm going to percuss for the lung field. So I want to go down and you want to make sure that you're not over top of the scapula because you won't hear anything. I also want to make sure that I'm intercostal because I don't, again, won't hear or feel anything. So I'm going to go down and just feel. And I'm going to be hitting my hand on you a little bit, okay? Just relax. Any pain?
No.
Okay. I'm feeling for any dullness, so there should be no dullness because the lungs should be full of air, which is tympanic, not dull. I'm also going to check back here while I'm here for any kidney infection, any problem with the kidneys. So I'm looking for this costovertebral angle, so which is right here and right here. This is around the area where the kidneys should be. So I'm going to go ahead and percuss. Tell me if you feel any pain, Peter.
No.
Okay, and again. Any
No.
pain? Okay. Now I'm going to listen to you, okay? Alright. Take a deep breath. Again. 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 And just do one more. And one more. very good. All right, so let's have you turn around for me. Now we're going to listen to the lung fields in the front here. I'm also going to percuss in the front. So we're going to go here and then pain?
No.
Okay. Anything abnormal there? Just going to percuss. I'm going to start here. Take some deep breaths. Again. Okay, very good. Okay, so I don't hear any wheezing, crackling. The lungs are nice and equal. I hear breath sounds in all lobes. Okay, so now we are, make sure I'm not forgetting anything here. I'm also, while I'm here, I am looking at Peter's neck veins. Again, I talked about the neck veins. I don't see anything distending or anything like that. I'm going to inspect the precordium. So what I'm going to do is place my hand here and just feel for anything unusual, vibration, thrills, heaves. Okay. All right, so I'm going to palpate the PMI, or the point of maximal impulse. Maximum impulse.
Sorry.
Cameraman, drop the phone. All right, so this would be at the mid-clavicular line, about the intercostal space. Right there. So I'm looking and feeling for any thrills, any heaves, any problems there. I do feel it. It feels perfectly normal. I don't feel any heaves or thrills. And sometimes you can actually check the pulse here too at the same time to make sure they're equal. And they are. Very good. Okay. And now I'm going to be auscultating the heart in a few locations. I'm going to do this in 3 different cardinal positions, although for here I'm only going to do one. I would typically do it sitting, leaning slightly forward, lying supine, and left lateral. But for the video's sake, I'm just going to have Peter sit. I would also, in all 3 positions, listen with the diaphragm and the bell. The first thing I'm going to do is listen at the second intercostal space, and that is the aortic area. And then I'm going to go left second intercostal space, and that is the pulmonic area. And then I'm going to work my way down to about the 4th intercostal space, and that would be the tricuspid. And then I'm going to listen down here at the apex. This would be the mitral valve area. And I'm going to count the apical pulse for a full 1 minute. And an adult normal pulse should be 60 to 120. And then again, I'm going to listen with the diaphragm So we have the aortic area, pulmonic, tricuspid, and mitral. And when I'm listening with the bell, I'm listening for any murmurs, anything abnormal with Peter, and I don't hear anything. I hear S1, S2. I don't hear any extra heart sounds and no murmurs. So again, I would do the 3 cardinal positions: sitting, supine, and left lateral. And that is it for our head, ears, eyes, nose, throat, cardiac, and respiratory assessment. Thank you very much.